Jeff Glaser, private practicing urologist. Been in the St. Charles area for about 19 or 20 years. The name of the practice, it's Specialists in Urology, and it's myself, Dr. Kim Burney, who is a female urologist, and then we also have a nurse practitioner in our practice that also provides care and treatment. We tend to see adult general urology. My partner does a lot of female urology. We see all aspects of general urological care, such as kidney stones, female incontinence, prostate issues, infertility, urinary stone disease. We really treat all aspects of urology. I always liked science when I was in grade school, so when I told my parents I remember in 4th grade that I liked science, and they said, well, one of the best ways to look and do science as a career is medicine. So I considered medicine and thought that medicine would be a great way to merge an interest in science with a fulfilling career that challenged both mentally as well as was kind of fun to relate to people on a regular basis. My first day in the operating room when I was in medical school, I had this big smile under my mask, and I thought, this is why I went to medical school, this is what I wanted to do. I thought that being in the operating room, seeing how people worked outside and inside was just fascinating. So I love surgery, and then I was thinking, well, what would be a great surgical career that would still allow me to be with the family and to pursue family interests, personal interests, and still pursue something surgical. And I thought, when I was in the operating room with the urologists, that they all had a good sense of humor. They all seemed to like what they were doing, so I looked in to see what the urologists were doing and liked what they did both professionally and the fact that they told good jokes. Women are very good at preventive health. They've been doing it since their early 20s. Men, it doesn't really start until their 40s or 50s. So they're all thinking in a typical men's mentality is that, well, I'm feeling fine. There's nothing that I need to worry about. Prostate cancer, just like most cancers, have no symptoms when the disease is early, which means also they have no symptoms when the disease is treatable. So by the time with most cancers you have symptoms associated with that cancer, it can often be too late to treat that disease. That's why it's important to do the screening with the PSA and with the digital rectal exam, because those will pick up the cancers before they're symptomatic, which means it'll pick them up in the early stages. Their outcome is going to be better, the treatment is going to be easier, and that 15 to 20 years from now we look back and say, well, you know, we had an uncomfortable time that we went through, but life is great. The typical recommendations or the screening recommendations are between the age of 50 and 70, or starting at the age of 40 if there's a family history of prostate cancer or if you're African American. Now, the caveat that I always like to add is, well, you know, there's healthy 50-year-olds, there's healthy 80-year-olds. So the big push, I think, is that we want to screen people beyond that, either 40 or 50, depending on whether there's a family history or not, but also screen them if they've got a 10 to 15-year life expectancy. We all know those healthy 75-year-olds whose mothers and fathers live to be in their 90s and even 100. And we know that there's people that are 55 years old that are very sickly and are not likely to be around in 10 or 15 years. So it's important to look at each individual to see what their mortality appears to be. And if there's a 10 to 15-year life expectancy, then screening for this disease is important.